Make sure to follow the instructions on the product packaging. Check the label to see if you should swallow the dose whole, chew it, sprinkle it on food, or mix it with liquid. If you are using the liquid form, be sure to measure the dose carefully with a special measuring device or spoon. Do not use a regular household spoon, as you may not get the correct dose. If you have any questions, consult your doctor or pharmacist. Some probiotic products contain live bacteria, such as bifidobacteria. If you are taking antibiotics, these products may not work as well. Be sure to take any product containing live bacteria at least 2 to 3 hours before or after taking antibiotics, as directed for your specific product. If you are using this product for diarrhea caused by antibiotics, do not continue using it if you have a high fever or for more than 2 days, unless your doctor tells you to do so. This could be a sign of a serious issue that needs medical attention. If your condition does not improve or gets worse, or if you think you may have a serious medical problem, seek medical help immediately. If you experience increased stomach gas or bloating that persists or worsens, it's important to notify your doctor or pharmacist. Also, be sure to inform your doctor immediately if you experience any serious side effects, such as signs of infection or a serious allergic reaction. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. Remember, it's always best to consult with a healthcare professional for medical advice and reporting of side effects. Before taking L.Acid-L.Casei-B.Bif-B.Lon-Fos capsule, make sure to inform your doctor or pharmacist if you have any allergies. This product may contain inactive ingredients that can cause allergic reactions or other problems, so it's important to talk to your pharmacist for more details. If you have health problems such as diarrhea lasting more than 2 days, a weakened immune system, recurring vaginal infections, or recurring urinary tract infections, it's best to consult your doctor or pharmacist before using this product. Some forms of this product, like liquid products, foods, powders, or chewable tablets, may contain sugar and/or aspartame. If you have diabetes, phenylketonuria, PKU, or any other condition that requires you to limit these substances in your diet, it's advised to ask your doctor or pharmacist about using this product safely. Before undergoing surgery, it's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it's best to use this product only when clearly needed and discuss the risks and benefits with your doctor. It's not known if this product passes into breast milk, so it's important to consult your doctor before breastfeeding. It's important to be aware that certain medications may interact with L.Acid-L.Casei-B.Bif-B.Lon-Fos capsule. Some of these medications include antibiotics and antifungals such as clotrimazole, ketoconazole, griseofulvin, and nystatin. It's crucial to keep a list of all the products you use and share it with your doctor and pharmacist. Remember to always consult your doctor before starting, stopping, or changing the dosage of any medicines. If someone takes too much of this medication and experiences severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Be sure to attend all your medical and lab appointments. It's important to note that some brands of L.Acid-L.Casei-B.Bif-B.Lon-Fos capsule may also include additional ingredients, like fiber or inulin. If you have any questions about the additional ingredients in your specific brand, don't hesitate to ask your doctor or pharmacist for clarification. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, skip the missed dose and take your next dose at the usual time. Don't take a double dose to make up for the missed one. When it comes to L.Acid-L.Casei-B.Bif-B.Lon-Fos capsule, it's important to store it according to the instructions on the package. Some probiotics need to be refrigerated, while others don't. If you're unsure, ask your pharmacist for guidance. And always keep medications out of reach of children and pets. When it comes to disposing of this product, don't flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard it when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. Remember, always follow the recommended dosage and timing for this medication to get the most benefit. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.